What to do if you experience a heart attack while alone? Do you know what to do if you experience a heart attack while alone? According to the Centers for Disease Control and Prevention, CDC, approximately 805,000 people suffer a heart attack each year in the United States. The alarming reality is that heart attacks can happen anywhere, whether you're driving, at work, shopping, or even at home. Now, imagine facing such a life-threatening situation without anyone nearby to assist you. In those crucial moments, every second matters and could determine survival. But don't worry. In today's video, we'll walk you through simple, practical steps that can improve your chances of survival if you're alone during a heart attack. Stay with us until the end, and don't forget to like and share this video. This information could save lives, including your own. Cardiovascular diseases remain the leading cause of death worldwide, and the statistics speak for themselves. According to the American Heart Association, 1 in 5 deaths in the US is due to heart disease. A heart attack, or myocardial infarction, occurs when blood flow to the heart is blocked, typically by a clot in a coronary artery. Without oxygen, heart muscle tissue begins to deteriorate rapidly, making every minute critical. Ideally, immediate medical assistance would be available, but the reality is that a heart attack can strike anytime, anywhere. If no one is around, having the right knowledge can be your best defense. Have you ever experienced a heart attack while alone? What actions did you take? Share your experience in the comments below. Being able to identify the symptoms is the first step in dealing with a heart attack on your own. Although the most common symptom is severe chest pain that is described as pressure, tightness, or burning, a heart attack doesn't always manifest this way. A few minutes or longer of chest pain or pressure that radiates to the left arm, back, neck, jaw, or stomach, shortness of breath, even when at rest, cold, clammy sweat, dizziness, nausea or vomiting, extreme weakness, fainting or unexplained anxiety, pale or grayish skin, or a sense of impending doom are all signs to be on the lookout for. In the US, an estimated 200,000 heart attacks each year occur in individuals who have already experienced at least one before. Recognizing the warning signs early can help minimize damage to the heart. Never ignore mild symptoms as mere discomfort. If you suspect a heart attack, don't downplay it. The sooner you acknowledge the seriousness of the situation, the faster you can take action. Even if you're alone, modern technology makes it easier to get help. Dial 911 as soon as possible and clearly state that you believe you're having a heart attack. Provide your exact location or an approximate address. If possible, put the call on speakerphone so you can follow the dispatcher's instructions hands-free. Do not attempt to drive yourself to the hospital. Losing consciousness at the wheel could lead to an accident, putting both yourself and others in danger. Time is crucial, and every minute without proper medical attention increases the risk of severe heart damage. If you're standing, sit or lie down in a position that eases strain on your heart. Keeping your head and upper body slightly elevated, using pillows or leaning against a wall, can help improve breathing and reduce the heart's workload. Conserving energy is essential during a heart attack. Aspirin acts as a mild blood thinner, helping to prevent existing clots from getting larger and potentially reducing heart damage. Medical experts often recommend chewing a standard 300 milligrams aspirin tablet if a heart attack is suspected, as it is absorbed more quickly through the mouth's lining. However, only take aspirin if you are not allergic and have previously been advised by a doctor to do so in such cases. If you are uncertain, your first priority should be calling emergency services. Additionally, do not put yourself at risk by searching for aspirin in hard-to-reach places. Avoid unnecessary exertion. Your safety comes first. Staying calm during a heart attack can be extremely difficult, especially when you're alone, but controlling anxiety is crucial. Panic raises heart rate and blood pressure, which can worsen the situation. Focus on slow, deep breaths. Inhale through your nose, count to 3, and exhale through your mouth. The American Heart Association stresses the importance of self-control in such moments. Simple relaxation techniques, like focusing on a fixed object or silently repeating a calming word, can help lower stress levels. Reducing internal tension decreases oxygen demand, easing the workload on your heart. While it may seem obvious, it's crucial to avoid unnecessary movement. Do not attempt to retrieve distant objects, climb stairs, or engage in any activity that increases physical strain. Every movement places additional demand on your heart, which is already under stress. Stay as still as possible in a comfortable position while waiting for medical assistance. If you are in a risky location, such as the shower or outdoors, move cautiously to a safer spot, but do so with minimal effort. Your main goal is to conserve energy and reduce the burden on your heart. If possible, remove or loosen any clothing that may restrict breathing or blood circulation. Unfasten ties, collars, belts, or tight-fitting bras to improve airflow and circulation. Though often overlooked, this simple step can help ease discomfort, reduce feelings of suffocation, promote relaxation, and enhance oxygen delivery throughout the body. Refrain from consuming food or beverages unless instructed by emergency responders. Drinking water or eating could increase the risk of choking, especially if nausea or vomiting occurs. To prevent complications, keep things as simple as possible. Focus on staying conscious, breathing steadily, and waiting for medical help to arrive. If you remain conscious, pay attention to how your symptoms evolve. Is the pain intensifying? Is it spreading to other areas? Do you feel numbness in any limb? Although it may be difficult to focus in such a stressful moment, any details you can provide will be valuable for the medical team upon their arrival. Staying conscious is also crucial. If you feel like you might faint, try to position yourself in a way that minimizes the risk of falling or injury. Your safety remains the top priority. While this step doesn't apply to the immediate emergency, it's essential for preventing future incidents. Understanding your risk factors is key. According to the CDC, conditions such as high blood pressure, high cholesterol, diabetes, smoking, obesity, and a sedentary lifestyle significantly increase the likelihood of a heart attack. If you fall into any of these categories, consult a doctor to discuss emergency protocols. Take proactive measures. Keep your phone charged, familiarize yourself with the fastest routes to nearby hospitals, and inform close friends and family about your condition. Some individuals keep aspirin or doctor-prescribed medications in easily accessible locations for quick use if needed. Heart health extends beyond responding to an attack. It's about prevention. Regular medical checkups, a balanced diet, moderate exercise, reducing alcohol intake, and quitting smoking can all contribute to long-term heart health. While knowing how to react in an emergency is crucial, taking steps to prevent heart disease is always the best approach. In the United States, various initiatives aim to promote awareness of healthy lifestyle choices, such as maintaining a nutritious diet, managing weight, and reducing the consumption of salt, sugar, and saturated fats. Regular physical activity is also emphasized, as these habits help keep arteries clear, lowering the risk of plaque buildup and blood clots. The American Heart Association recommends at least 150 minutes of moderate exercise per week, along with a diet rich in fruits, vegetables, whole grains, and lean proteins. Additionally, managing stress and prioritizing quality sleep play vital roles in maintaining heart health. Another key factor is recognizing early warning signs. If you experience symptoms like unusual fatigue, heart palpitations, or chest discomfort, don't ignore them. Addressing issues such as high blood pressure and high cholesterol early on can significantly reduce the risk of experiencing a heart attack alone. It's important to remember that these preventive measures do not replace urgent medical attention. If a heart attack occurs, seek emergency assistance immediately. Now, we'd love to hear from you. Were you already familiar with these heart health tips? Do you have any personal advice or experiences to share? Leave a comment below and help others stay informed. Knowledge can save lives.